So Upper Shore Agent's responsible for senior care through the state for the 3 counties we serve. But in this case, with the other 2, we operate out of our Chestertown office and then into the counties. In Talbot's case, we provide the funding directly to them because the program is so effective. So they run the entire senior care program.
It's our EHRs program. It stands for Adult Evaluation and Review Services. So every health department in the state has an EHRs program, and we are nurses and social workers that go out into the community and do evaluations for people who are either in need of Medicaid services, home and community-based services, or like for our senior care program, we do the same assessment for those in our senior care program who are usually a little bit higher than Medicaid eligible as far as their income, but
So if I'm
still
right,
low income.
Talbot is just one of 2 in the state that do
Yes.
it out of their health department, senior
Right.
care services, right?
Yeah, it's us and Allegheny County. We're the only counties who have senior care meshed in with their EHRs program. But we really think it's like the best practice model because our nurses and social workers can also be their senior care case managers. And when we go out and do the evaluation, we can determine right there if they're eligible for our senior care program. We can do the paperwork right there and get them enrolled right away. Whereas in other counties, the EHRs program would do the evaluation and then make a referral to their senior care program, which might be at their AAA or it might be at their Department of Social Services. We provide case management to all of our clients as far as linking them with resources and really just helping them with anything that they need. And then as far as actual services that we can provide, we do the emergency response systems, like the buttons they can push if they've had a fall or medical emergency. We do incontinence supplies. We help people pay for some chore services if they just need some help doing their chores around the house. Nutritional supplements like Ensure and Glucerna. We have a really wonderful CNA, certified nursing assistant, Donna, who actually goes out to homes and helps people with bathing and dressing and their personal care. This is all stuff that like your Medicare wouldn't cover. So it's, insurance isn't paying for it. There is no other resource to pay for.
And the bottom line continues to be to keep people out of nursing homes, hopefully forever, but at least slow down that path. And that's the reason the state funds the program, because it costs so much more on the other side. If you do go to a facility, I think that we're just as committed because it's a quality of life issue to stay in home. I mean,
Right.
studies show that you literally live longer and have a more productive life than if you're in a nursing home.
1982,
Yeah.
it started as a pilot program.
One of maybe
Talbot
3
County.
counties in the whole state, right?
Something like that.
Yeah, so Talbot
Yeah.
turned into a rock star, especially for
Yeah.
rural senior care, as a matter of fact. Yeah, so when the state, God bless them, finally did pull back the extra funding and leveled it off to be like everybody else, the county council was so impressed with the program that they actually stepped up, and the county contributes a substantial amount of money as well, which is unusual for senior care. It's usually just straight from the state, but the program
Yeah.
is so effective at keeping people out of nursing homes that the council saw credibility in it.
Right, and their funding actually helps us serve probably about another third more of
Yeah.
clients that we wouldn't be able to just with the state funding.
We all know of the grain of the Eastern Shore and the attractiveness we have for retirees. And again, as we had just discussed, we have this perception, especially in Talbot County, that those are wealthy or middle income individuals moving over. That's not always the case. There are those that come over and there are those that have been here all their lives that really aren't, for no fault of their own, making the big bucks that have them live an easy retirement life. And those are the individuals that we need to provide services for, and we need to step up. So yeah, it's absolutely, I'd love to tell you it's decreasing or at least leveling off, but that's not the case. Between meals, you can go across the gambit, senior care, Meals on Wheels, every single program. Frustrating part is the state, understandably, Governor Moore's made it very clear they're in a belt tightening mode, don't have increased funds for these programs. So we have seen level funding for many years. So Upper Shore Aging has gone to the trouble of trying to do fundraising, and you're familiar with that. We've talked to you about that before, but that's all because we're not stagnant, we're not leveling off, the need continues to increase. Senior care is an easier program to administer in that it's a smaller program, it's gap filling, and it's, I think, part of the real success. It's not as cumbersome or convoluted as waiver or things of that sort, which is where you may progress to. But it's been a really nice first step into senior care assistance through, in this case, Talbot County Health Department. But I really don't know what seniors would do in Talbot County without the health department's involvement. Not that we're not doing the best we can in the other counties, but having the qualified nurses going out to do assessments, it's a real knockout for Talbot County citizens. It's a real blessing that we don't pay a lot of attention to, but it's really something.